organizations that we support. Having said that, we have a relationship with SASSA. We were key in making sure that the social relief of 350, if it wasn't for this leadership that I'm talking to today, we wouldn't have much to say about those communities in the rural areas having benefited from the 350. So I really, from the bottom of my heart, thank you for that leadership. Thank you for the we've had, weathering every storm, weathering all our mistakes in the name of changing lives of the deserving communities of our country. And thank you as the civil society for agreeing to say, little as we have, it's next to nothing to agree to facilitate all these processes that we get to speak about today. So I wanted to start from that note to say, I'm here to confess all my sins. I'm here to plead for your forgiveness. I'm here to say it was in the spirit of winning the bigger fight of economic emancipation of the civil society sector. That's where I wanted to start from. Then in terms of the program and how we're going to be moving along, ensuring that we sustain this program, we're still going to have some lot of this deliberation and lot of this discussion. And I will be guided by your experiences. I will be guided by your expertise. I will be guided by the challenges that we have learned from, which is lessons learned, for us to improve in a lot of our systems. But the bulk of the systems in terms of compliance and policies and PFMA, we have jumped the first hurdle, which go now from now on going forward, we shouldn't experience much challenges in terms of the information that we expect from you guys to the information that we process to release the payments in terms of stipend. So I want to say in those few words that I'm looking forward to the deliberations. I want you to be as honest and at peace, and I'm so accommodating to say, let's walk this journey together. NDA cannot win this battle alone. Social development, SASSA cannot win this battle alone. But it is this leadership that I'm talking to and I'm talking with today that will see us post the COVID, not even post the lockdown, but post the COVID, to look back and say, that's a legacy that we created with the civil society organization. And we would have then achieved the job opportunities as permanent, would have achieved the issues of grounding the program at an NDA to champion the development in the country using the district development model as pronounced by our president. I must say, in applauding you again, you have posed serious challenges and serious threat to many of the community activists out there who are claiming to have been doing work and who have been getting so much funding, and there hasn't been much to show for such. Your report that you continue to present, really they are finding expression at the net joints, they are finding expression at the National Council, Coronavirus Council, that is chaired by the president himself. Portfolio committee, whenever we go to portfolio committee, they continue to ask about you. They continue to feel the impact that you are doing on the ground. In those few words, I want to say, Mandela, our father, icon struggle, he used to say, it always seems impossible until it's done. I know that right now we're feeling the pinch, we're feeling the heat, and indeed our stalwarts felt what we are feeling right now. But in the spirit of leadership, in the spirit of changing lives, in the spirit of staying in the cause, one day we'll look back and say, it was worth it. It is with those few words that I want to appreciate, I want to applaud, I want to profusely, humbly apologize for all the mistakes and the errors that we have committed as an agency from that time until now. But at the bigger picture, we want to make sure that come next year, in terms of local government election, we want to put our footsteps where you have started laying the ground for us to champion development in local government areas. With those few words, you are all welcome. I'm happy to have you. The CEO of SASA is looking forward to have an engagement with you. Like I'm saying, this is the first, but surely it's not the last. We'll have to continue have this interaction. The provincial managers are part of this session. The development managers, the development officers, we will go on and grow bigger, and we'll learn from the mistakes that we've had. We'll learn from the experience that we continue to be confronted with in communities as we win the battle of poverty that is a pandemic itself. Other than the pandemic of COVID, we have a pandemic of unemployment, we have a pandemic of gender-based violence, we have a pandemic of poverty. So with those few words, I'm saying, I'm here, let's hold hands, let's journey together, let's continue to fight side by side for the just cause of changing lives of our communities. Thank you very much, Lerato. Thank you very much, Chairperson. Lesejo, thank you, MC. Or my Ivy, I'm not sure my Ivy.
Let me do it. I draw my confused.
Okay. Thank you. Thank you very much, CEO, for that detailed overview of the program, and appreciating the work that is being done by our volunteers on the ground. Now we are going to call Mr. Nkoskhona to give us some perspective on the volunteerism and the impact of the NDA COVID-19 program. A big welcome to you, Mr. Mpungose. Please take over.
Well, thank you so much, Chairperson. I hope I'm audible enough. The name is Nkoskhona Mpungose, and I am from His Majesty Province, known as KwaZulu-Natal. And yeah, one must firstly appreciate to be in the space of this kind of meeting where we are able to interact with our peers, first of all, as civil society, as well as also with the leadership of the agents. I mean, having to speak direct with the CEO, it's one of the blessings that we have as a civil society organization, especially as youth organizations, which in most cases, we've never given such platforms in order for us to even grow and develop from our own respective corners. So I want to applaud NDA for creating such a space and allowing us to grow. Because in everything that I would say, it's based on our growth and also the willingness of civil society to learn and also not expecting anything, because that's the backbone of voluntarism. So when a call was made, especially on the first 21 days of lockdown, to tell you the truth, everyone had no idea on how to go about even executing the work from the ground. But like the CEO have said that PPEs were already at our gate. We were already wearing PPEs, and we had to now go and abstract the work. But there was no manual for us to actually go and run the program in community. But because we are at community base, we are community members, we understand our community. We started by first understanding what was the challenge at our own community, which number one, the challenge was information. We didn't understand what regulations was. So we had to start the regulations. Again, this opportunity didn't just make us to go out there, but it also gave us an opportunity to study these things. We studied regulations. We translated regulations to our own language so that it speaks to the people in our community, so that they understand when they say such things are not supposed to be done, why is that needed. So we went there with our open hearts, knowing very well that we will be attacked in society. Remember, we're going into community where people were asked not to move around. They were asked not to go to work. They were asked not to do anything, but to follow the guidelines that we were addressed every day to say, now, this is the new thing. Now, this is what we should do. And I think before the CEO, someone spoke about this day to work closely with police stations. That was an option for, I think that was for everyone, I think, across the country. the first thing that we had in our mind was safety first. Let's go and report to the police station that we are given the task. We would like to execute the task, but we're unable because we needed the visibility of security. And that on its own exposes us to other stakeholders, which police stations were the stakeholders which we had to communicate with. We were then invited in local command council teams where we had to sit on a security cluster. We were exposed on the leadership of army. I mean, at one point, I think now through NDA program, I'm now called general in my community. I was then named General Uzi because I was seen leading the soldiers. Because soldiers, when they came in our community, they told us we normally get to be commanded. So you guys need to tell us how you want us to secure you and how the program will unfold if you go to this mall, if you go to this taxi rank, and if you go to the certain communities. Because, I mean, people believed our first PPEs, which was those white overalls. When we were wearing those white overalls, people thought it's either we're going to fetch a deceased in the homes, someone already have died, or we are carrying the virus to spread it in community. We were called Amakorona Mabi in KwaZulu-Natal because in different 5 province districts that we were reporting to, that was the experience that young people actually have found on the ground. But irrespective of all the challenges that were there in community, irrespective of community being negative on us, irrespective of not having resources to move around. Remember, at the first 21 days, there was no transport at our disposal. People had to walk. At one point, my team actually, I was so humbled. We walked for 18 Ks to a particular community where we were called to come and educate people. We were not only educating communities, but we were also facilitating education in clinics because people were also not, especially also our own essential work, essential workers or frontline workers, they needed us as communities because now they were in the space of government. So it was us that had to now address our own community to say, hey, we understand this is going to be difficult, this is hard for us, but in order for us to survive this stage, we need to follow these rules. The reason these rules are put in place are there for us to survive, number one, for us to not to be infected, and also to allow the country and the process that the president and national command team have put in place in order for the society to survive this pandemic, because everyone was shocked. But as we were picking up what you call is the feeling on the ground, and as we're also reporting back to NDA to say this is what we are feeling on the ground, and NDA with their very much also activeness, they responded with everything. They gave us opportunity. We were asked to design our own things the way we feel it will speak to our community. If we wanted to do cartoons, we made cartoons that speaks about COVID. We changed everything to speak. I mean, we even used broken language, which is much more friendly to young people, where we used mixed language. We used excess instead of addressing in the formal way, so that young people also felt, being addressed in that manner, because they wanted to see colorful posters. They wanted to see message that they use on the street, so that they feel they are part of this. They feel that the message is addressed to them. And all in all of that, learning as we walk, because that's what actually was happening. Until today, we're still learning. Voluntarism has taught us to be humble, number one. And also it has taught us that if you are humble and if you love what you do, if you're passionate about what you are doing, voluntarism will show you magic. It will take you from nowhere to elsewhere. We were then approached by the Department of Health after having been introduced to social development and also through NDA, because they were the one that were holding our hands and also linking us to these different stakeholders to say, hey, in order for you to grow, in order for you to also be in the space where you're able to maneuver and work with limited challenges, we had to make sure that Department of Health knows us and they also work with us. On its own, we were then also invited to, even ask for more people to join our team, from having 10 team to now being joined by 15 young people that we now have to go and screen people in schools. That is because we humbled ourselves and we said we wanted to make sure that we make changes in our society. Voluntarism. We knew that there was nothing for us to gain from there, but we knew Uti experience was there. We also knew that it will leave us with a very good profile for organization. Community will know us that we were there for them when there was no one else. I think the CEO also said that many civil society that has been getting a lot of funding, they couldn't move until they are at their own homes, their offices are closed. But we at our disposal that we confronted the COVID-19, we are still busy today. So to speak about the growth and the impact that we've done in society. We're in the level in a eThekwini municipality where if they talk, we have a civil society forum, which we form part of youth sector, which is one of the 18 sectors that reports direct to SANEC. Maybe also to brag with KZN. Our report was also taken to Provincial Council on AIDS to say this is what civil society is doing on the ground during COVID-19. It will be a report that will form part of our Provincial Council on AIDS in the province, in KwaZulu-Natal, and it will also be said on SANEC. I think also social development will be receiving that through those councils, that we also make sure that the report that we submit to NDA also reaches other councils so that they know what civil society is doing, and also they start calling us in these spaces that we've never given a platform for us to have voice like the one that we have today, direct with leadership of different agencies, different departments and different portfolios. And also with that, the impact that we've done, I will be lying if I can read the stats on the impact that we've done, but I can just share a few things. That when we were given a platform on relief to work with social development, we were given food parcels, and volunteers of the organization, instead of saying, hey, I'm hungry, I'm not getting paid, this first pack is going home. We first said we want to go out and look for child-headed homes, because we know in our areas that there are communities that there isn't an elderly person in that house. It's only children, and they depend on the multi-school program that they eat from, and the schools were closed, and we had to make sure that we prioritize those people. And our second priority was the elders in society. We had to go and visit the houses that we know to make sure that also those old people, we give them understanding why they have to stay home, and make sure that we also understand what is the challenge for them during the COVID-19, because it has challenged everyone. But for them, it was worse because now they're old, they can't travel, they can't go elsewhere, they have to go out and fetch their medication. We have to now sit down and make plans, because we're working with the Department of Health to see how can we also arrange for their chronics to be delivered at their house. Up until today, that program is running. And they said they will announce, of course, today in the morning we were at the clinic. We were told that they would announce when the program will end, but for now, we were told not to be stressed, because all people are still getting their chronics. They're delivering the chronics through our what you call is stakeholders that we've tapped into during the program that we are doing in the process of COVID-19. And with social media and also community radio stations, we made sure that I think right now we've reached listenership over 1 million every month when we go to radio stations, different radio stations. We work with 5 different radio stations that we go there and tackle issues of COVID-19, reading also stats and also translating what does this stats means to the public. And also on social media, we've actually highlighted a lot of engagement with our hashtag. Young people have also felt as they were part of the hashtag, the COVID-19 info team, where they will actually say anything that they didn't know, and they will tag us with that hashtag and we'll respond to them. And they were very happy with the instant that we were on WhatsApp, on Facebook pages, on our Instagram, as well as also on our Twitter. And again, because we've said this was also based on volunteerism, we make sure that we are not complaining about our data, understanding that this is also costing very much for us to maintain. But we make sure that we commit ourselves that at our space, we will make sure that people get information, a very well updated information. I think we've also been uploaded on that with our own youth sector in eThekwini to say, with regards to COVID-19 information, when they want updates on that, we will be actually called to give stats and also to give the impact that we've done in our own little corners, because there are different communities that we serve. And like I said, it will be very difficult for me to read out the actual stats. But as the CEO has alluded, the numbers are very high. The change that we're making in community, people are seeing it. We're not just talking, but people are seeing action. And that is what we are happy about. And with regards to the PPEs, I'm very happy that the CEO has also addressed that matter and made it very clear for our colleagues as civil society organizations in this meeting, which now it's very clear, and it makes more things for us to understand why other delays were made. But we are very happy that that was addressed. And we are very happy also with the introduction that the CEO has made, the first activist. We are happy that you recognize yourselves as an activist, not as government first. That means you understand our pain, you work with us, and to again share with our peers as a civil society organization is that at any given time, when we want to have a work with the CEO, for the first time, we have the CEO that is part of our conversation in WhatsApp group. It's the first time. We've never had that platform where we'll have a CEO in the WhatsApp group. We only know that CEO, you only get them through the PA, through the emails, and it takes a month. We have the instant connection with our CEO at NDO, and that on its own, it shows that the CEO understands the pain. Number one, the CEO want to be with us at any given time. Whenever we have challenges, the CEO respond. Maybe the CEO won't respond, but we'll start getting calls from the provincial offices to say, hey, we are hearing this, how can we help? And that is what we've been very happy about with regards to the response of the NDA when we have challenges on the ground. And they are very much interactive, especially with us as well. Also, it's been giving us more motive to continue with the work that we do in community. So I would like to end there so that I don't eat much time of our colleagues. Thank you so much for the opportunity.
Thank you very much, Mr. Mpungas.
They're allowed to pray.
Yes, can we give a round hand of applause to Mr. Mpungas, please? Thank you. You can mute your speakers now. Ladies and gentlemen, next on our program is Ms. Tutsi Memela, the Chief Executive Officer of SASSA. However, she has requested that she joins us at 4:10, which means that in between the presentations, we are going to have to let her through. And I would also like to bring everybody to please observe the time that is given of 5 minutes so that we don't run out of data in our various provinces. Now, can I please call the first province to present, Eastern Cape, Ms. Linda Jack from the Sinetemba Development Community Center. Over to you, Ms. Jack.
Thank you, Program Director. I greet you all this afternoon. Happy to be in this meeting. Also, knowing that this meeting from today onwards is going to bring more way forwards rather than more questions. I am Linda Jack from Sinetemba Developmental Community Center in a town of Port Elizabeth, Township on Woma. I'm representing all the CSOs in the Eastern Cape. The total number of volunteers that we have is 206. We have 139 females, 78 males, 146 youth, no persons with disability. And the total number of direct and indirect beneficiaries living off NDA stipend is direct beneficiaries is 206 and indirect is 1,043. That is 1043. The rating success of the program is 7 to 10. The impact of the program. We fostered relations between Department of Health, Cooperative Governance and Traditional Affairs, the South African Post Office. We assist mainly now in the administration and registration of the 350 unemployment grant. The volunteer stipend contributed to increase in household. We as Sinetemba, we started in March. We were contracted by NDA in doing awareness in our community, COVID-19 awareness. We had a lot of challenges on that sphere because people now were not used to staying at home. We were new on the program. Even us as volunteers, we had our fears. How are we going to be doing it? Because the COVID-19 came in very badly. Everybody was fearing for their lives. Numbers were rising. Everybody was not knowing what to do. But as Sinetemba, we applauded the opportunity that we were awarded the contract by NDA because number one, NDA is from East London. How did you get to know people from Woma? So we said to ourselves, let us show our uniqueness. Let us show our eagerness. Let us show our passion on helping the government, in helping our communities, in combating, in trying, in fact, to combat the impact that was being made by COVID-19. We went in there in our communities, having been provided PPE by NDA, having been provided sanitizers by NDA, we armed ourselves with those things. We went in strong and happy because we were doing something for our community. We were doing something to help with the government. But we had challenges. People were not used to staying at home. So what were we going to do? Children were at home and children were not used to not being at school during the day. So children decided to use the parks around in the township to be their tournament venues, soccer tournament venues. And that is when we had to go to the SAPS and ask for assistance. Assistance were given all the time. The policemen and the army were accompanying us when we were going around in the community trying to help. With the 350 registration, came in again NDA saying, Sinetemba, we are giving you this task again. They gave us the opportunity. We started in May with the 350. We were happy because we were doing something for our community. But during that time, we found out that a lot of people were unemployed, number one. And we found out that not only was unemployment an issue, but also poverty and hunger was the issue around our other households. How did we find out that? We stipulated a template as Sinetemba. We had the name, your ID, your address, and what we also was how many people are in your household and how many people are working. That is when we found out that a lot of people are going home hungry and a lot of people are not being looked after well. So with our highlights, on COVID-19, awareness raising COVID-19 door-to-door was number one. We went also to the post offices. How did we find out that there is an issue with the post offices? When we're doing the registrations, people now were turned back from the post offices because what was happening was people, when they went to the post office, they were told by the post office assistants or managers, we know nothing about this thing and we don't know how to help you. We don't have any information on that. What we did, we approached the post office, our nearest post office, that is Woma, and when we approached the managers there, she said, no, I cannot do it alone because we have a lot of post offices. That is when she introduced us to Mr. Mama, that is the regional manager of all post offices in Nelson Mandela. We arranged a meeting with Mr. Mama. We met with Mr. Mama. Mr. Mama said to us, yes, we do have a crisis, but how are we going to be doing it, Sinetemba? Number one, the post offices are scattered. It's not only Woma. Post offices are scattered and we are only 10 volunteers from NDA. How are we going to be doing this? Okay, we are going from the stipend that we're getting from NDA, we are going to recruit another 10 volunteers, which we are going to share from our stipend with those volunteers in order for us to be able to help around the post offices. How many post offices do you have, Mr. Mama? Mr. Mama said, in Nelson Mandela only, I have 19 post offices. So we had to add 10 more volunteers again, recruited by us, because NDA knew nothing about them. So we had to divide our stipend from the 10 stipend from the NDA with the 10 that we recruited ourselves. Mr. Mama, how are we going to be getting to the post offices that need help? Mr. Mama offered transport. We were successful in that. He said, we are going to pick you up from your venue and we are going to deliver you to the post offices. Mr. Mama, we are not enough. How? Give us the hotspots, post offices. Mr. Mama gave us the hotspots. He gave us Kinako in Port Elizabeth. He gave us Kwatwesi Post Office. He gave us Green Acres. He gave us Newton Park. He gave us the main post office in town. He gave us Woma. He gave us Utenake. And he gave us also Newton Park, and that is how we divided ourselves. We took 2 volunteers each post office, 2 volunteers each post office, 2 volunteers each post office. What are we doing in the post offices? We assisting in queue walking. We assisting in social distances. We assisting in the wearing of masks. We're assisting in sanitizers. There were a lot of challenges that we encountered because there was an influx of people that were in the post offices. How are we going to be helping these people? We have to have volunteers which are passionate about this whole thing. And our volunteers did the trick. Now, in post offices around Port Elizabeth, there is no chaos. I can assure you, there is no chaos. We also had to go to SASSA because people that were doing themselves the registration always went to SASSA to inquire about their problems. And SASSA, because they don't have enough information or whatever, they had to bring them back to us. Then we took 2 volunteers and put them up to SASSA. What are they doing at SASSA? They are helping, number 1, with queue walking, with bookings. They are helping with the sanitizing. They are also helping with sanitizing and queue walking and everything. But also at SASSA, what we found out was because of COVID-19, SASSA had a problem of having to separate workers. This group goes in this week, this group goes in the next week. And then, as our volunteers are there, what the officials cannot do, our volunteers are able to do. I'm giving you an example. There were cases of foster children that did not, there were cases that had to be taken to court, and the officials could not bring the answers to the community back. But because we have our volunteers there, our volunteers are taking responses that are coming back from the court to the relevant families in the community. That is helping the officials with the work from SASSA. And now, when the other 5 at our SASSA local office is not there, our volunteers are always there. There is always a volunteer at SASSA. There is always somebody there at SASSA, by me. There is always somebody there at SASSA. Okay. Our challenges, what we have as challenges, because on the queues, we have to check the status of the beneficiary. So that is also eliminating the number of people that go in to the post office. Now in post offices, instead of them helping 100 people, the post office now can help per day plus minus 800 people, because now people are eliminated from the queue by our volunteers. We're using our cell phones to check the status. And if the status is saying you have to go to SARS, for instance, to check your RIP5, it is appearing, then the person is taken from the queue immediately and no waste of time into the post office. That is eating our data. That is eating our data. As SASSA, we are asking to be compensated for the data and PPE and everything. Thank you very much, people.
Can we give a round of applause? Thank you very much.
Good afternoon. Enkos Mamlinda, for your detailed report. Can I please remind all presenters that we need to stick to the allocated time of 5 minutes. At this stage, I would like to invite everyone to please comment on our chat. It's next to the hand icon there on the screen. You can write your views, share your views with us. And that said, I would like to welcome the CEO of SASSA, Metusi Memela, who will now address us. Welcome, CEO. Over to you.
Good afternoon, colleagues. Good afternoon, our awesome partners. I must say up front that I've been ambushed by the CEO of NDA. She didn't prepare me, because if I had been better prepared, I would have ensured that I'm here to attend part of the whole program as you engage and give feedback on what is happening on the ground, so that I'm able to what you call to see what it is that we need to do, even to iron out some of the challenges that you have on the ground. I must say that more than anything else, what I just wanted to say was, I cannot thank you enough as our partners, and I refer to you as partners and soldiers in dealing with poverty, soldiers in poverty alleviation. I don't know what we would have done in the past 5 months without your support. And I know that in many instances, there are things that we committed to that we haven't been able to deliver on, particularly on the issue that relates to the data. And it's not because we're necessarily short of resources. It's more because of the protracted processes that government has that makes it difficult for us to just say, oh, ngoba now we know that you've delivered, we'll be able to give you 300 rands a month, or whatever the case may be, without us making sure that we've built processes and strategies for us to make sure that we can, at the end of the day, be able to what you call report to the AG on what it is that we have done and how have we actually allocated the funds of the organization. We had a meeting last week where we're talking about the same issue, because not only has it been raised by you on the ground, but it's also been raised by the people in the portfolio committee to say people are on the ground, they're assisting our communities, because without them, we wouldn't have been able to get the number of people that we even currently have. For example, in terms of just the number of people that applied for the 350 grant, we have 8.5 million people that applied. And I don't think we would have achieved what we've achieved without your support, without you being able to walk on the field and actually make sure that you assist people to be able to apply. So I do agree that the issue of ensuring that we provide you the data as per our commitment is important. What we've done is we've agreed with the CFO that what the CFO needs to do is to make sure that they allocate the data, the budget to the regions, and for the regions to work together with the NGOs that are providing the support to make sure that allocation actually happens. Because our thinking initially was that what we could do is you could actually provide the support, but we know that you provide the data and then you can then claim from us. But we know that you don't have the financial muscle nor resources to be able to do that, hence it would be very difficult. So now we're engaging together with the regions to say, region, if you know that in this particular area, these are the people that you are working with, because the AG, unfortunately, what he's asking us is what will be very difficult, I believe, for us, for your teams on the ground to be able to report on, because the AG says, tell me, if you gave them data for 500 rand, did they actually use it for what you call for SASSA clients? And it becomes very difficult for you to track that. How are you going to do that? Because the people that we're working with, the people that we're working with on the ground, they're young people that don't even have the statements. And in many instances, these are people that actually have got airtime. They're using their own personal airtime now. They don't have a statement to come back to you and give you and say, I phoned Totsi, I phoned Thamo, and Totsi and Thamo are SASSA clients, and the rest of the people are not SASSA clients. So if you can just understand that it's not because we don't want to provide the support, it's just the demands that the AG is making on us that makes it difficult for us to actually make sure that we provide you the support that you require. Because at the end of the day, when the AG then makes his findings, like he's made his findings now, and is claiming that we've given money to dead people, there's no dead people that we've given money to. People did apply and subsequently died. it doesn't mean that we've given them the money. So all I'm asking is for you to appreciate why we had a challenge of not being able to provide the resources at the time when we're supposed to provide them. I know that it's late now, but it's never late. It's never too late than never. So we'll make sure that in terms of going forward, that the regions work with the stakeholders so that we can make sure that we can quickly provide that support to all the community development workers on the ground and our champions that are working to support our people to make sure that they can be able to deliver what counts. The other area that I think is a big value add that the teams that you have on the ground have been providing for us is to make sure that we do the queue marshalling when on payday, because that also helps in terms of making sure that the people that are going to the access points, because, and this is what our communities actually don't understand, which is the difference between an access point and a pay point. An access point is a place where people go to because they choose to. If I choose to go to a particular ATM, it may not necessarily be a ATM of SASSA or of post office, but I go there because I've got a card and then I can be able to provide to swipe. So you've been providing help not only in the post offices, but also in our hotspots where we have long queues, and the teams have been working on the ground to make sure that they help with the queue marshalling. And you have no idea how appreciative we are of the support that you've given us over the past few months. We're just saddened by the fact that we couldn't execute on our side, not because of lack of resources, but just because of government regulations in terms of making sure that when you spend, even if it's 5 rand, is that you are able to account for it. But I believe that the regions now have been given through the CFO together with the what you call the person responsible for grants. They are now going to allocate those budgets to the regions, and the regions will work individually on the ground with each and every institution to make sure that we provide support for the time that is lagging, that is still remaining. The other interesting thing is, much as initially when the 350 SRD grant actually happened, is that we understood it to be a grant that is going to happen until October. For now, we actually don't know whether it's going to finish in October or it's going to be extended beyond that. Again, it's because government understands that people are really, really stretched in terms of resources, and many people have actually lost jobs. And believe it or not, we continue to have people that are applying for this SRD grant. So all I want to say is thank you for your support. We'll make sure that on our side we deliver what we had committed to, so that we can make sure that we also patch and make sure that you don't end up using your own resources to do what it is that you are supposed to do. I think each and every person that has been working on the ground actually needs to be given a medal for being a soldier in dealing with poverty, because that's basically what those community workers have become. They've become soldiers on the ground that have helped us impact on the lives of our people, all people that are actually people that are poor people. So I cannot thank you enough in terms of the support that you've provided. And I think this, from where I sit, this is a starting point in terms of what we need to begin to do as government, because these young people have become champions of as community development workers in terms of making sure that they make a difference in the lives of our people. So all I was asked by Thamo to come and say was just to give thanks to you, to give thanks to each and every person that has been on the ground and helping. But I'm glad that I was able to pick up the discussion when I came in terms of the lady that was facing some of the issues. And I hope I've been able to report back and for the teams to understand that they can continue to engage with the regions to make sure that we deliver what we've committed. Thank you very much. Thank you.
Can we give a round of applause, please? Thank you so so much, CEO of SASSA, Mr. Timemela. Ladies and gentlemen, before I go on to the next province, I just want to know something. The CEO of NDA, Mrs. Mzobe, has asked for your forgiveness. She has pleaded with you to please forgive her and promised that things will go smooth moving forward. So I really need an answer from you all. Have you forgiven her?
Yes.
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 Yes. Okay, thank you very much for that. I will call on the next province, Limpopo. Can I call Leslie Nkanyani from Limpopo Poverty Alleviation in Mudimule to give us a report of the province? And please, I'm pleading with you, keep to the allocated time. Thank you. Over to you. Mr. Nkanyane, are you there? Mr. Nkanyane? Okay, I think in the interest of time, while Mr. Nkanyane is connecting, can we call upon the next province, the Free State?
Mr. Nkanyane is online. Can you hear him?
Is he online? Okay.
Yeah.
Over to you, Mr. Nkanyane.
Good afternoon, everyone. My name is Leslie Nkanyane from Limpopo Poverty Alleviation. I'm representing Limpopo Province. I'm not going to waste much of your time. Let me go straight to my presentation. Provincial overview. Number of CSO participating in program 22 only. 12 CSO are working. Total number of volunteers 216. Females 144. Males 72. Youth 186. Person with disability 0. Total number of days worked 453. Total value of stipend received from NDA 391,125 rand only. Total number of beneficiaries living off NDA stipend 216. Total value of stipend outstanding from NDA 225,000. PPE received, yes. Rating of success of the program, 8 out of 10. State of organizations are SEOs in the province, united and organized. Yes, the organization in the province are organized and they perform their duties accordingly. They even go extra mile by working more days as expected, and they even assist community members with sanitizers. Has the NDA facilitated networking and collaboration opportunities among CSO in the province? Yes, the NDA has well facilitated the program because before we started implementing the program, NDA officials conducted the organizations to brief and induct the volunteers on what is expected of them. Summary of service delivered to communities. To raise awareness on COVID-19, and in particular on social distancing, sanitizing, washing hands, and wearing of masks, Our main focus are hotspots, areas where people gathered in large numbers, to conduct door-to-door awareness, to spread the information about the coronavirus, to assist if someone has symptoms, and to assess those who are in need of food in order to inform social development. How has the program impact communities? Most communities appeared the presence and the information given by volunteers about COVID-19 more to regulations after being educated and advised. The program reduced the widespread of COVID-19 in communities. Recommendations for the program in future: to continue to raise awareness about the virus beyond level 2 lockdown. The CSO should be provided with enough pamphlets. 1 week program induction is recommended for stakeholders and CSOs in order for all to understand the role of volunteers. To target more on hotspots like shops, taverns, or where people are gathered in large number and less on door-to-door visit. The NDA to engage the Department of Education to make it easy for the volunteers to raise awareness at schools. NDA to also ensure that the payment of volunteers is done on time. Highlight of the program: the volunteers continue to give information and educate people on the COVID-19 of negative attitude they get from community members. The volunteers continue with awareness raising at shops and at hotspots to maintain social distancing to minimize the infection of the coronavirus. The support from tribal authorities is commended. Challenges of the program: shortage of food parcels for the community, number of days not enough for reporting, as some of us work at remote villages, no accessible public transport to be reached, children playing in large groups. People in some communities are chasing volunteers away and don't want to see them, as they say coronavirus does not exist. When asked to wear masks and to sanitize their hands, people respond to say they are not afraid of the coronavirus and of dying. That is the end of my presentation. Thank you very much, Program Director.
Thank you so much, Mr. Mashaka. That was nice and short. Can we give a round hand of applause, please? Okay, our next speaker is the Free State Province, Miss Alice Pirime from Realebo Habakubung. And we would also like to keep on emphasizing the issue of sticking to time. We'll start introducing a bell if a speaker goes beyond the allocated time. Over to you, Mema Pirime.
To the CEO of NDA and SASA CEO and protocol observed. On behalf, I'm presenting the report on behalf of the CSOs of the Free State. And first of all, I would like to say thank you to NDA for giving us the opportunity to roll out the volunteer program. And I must say to Mayor CEO wa NDA, that this program is really assisting a lot of our young people, and for most of them is they are able to put food or bread on the table through the stipend they get from NDA. So we're very thankful, and we hope the program continues. The number of CSOs in the Free State participating in the program are 22, and the total number of volunteers are 220. Of them, there are 132 females and 88 males. And of the 220, there are 175 youth, and of course, we don't have people with disabilities. And the total number of direct and indirect beneficiaries living from the NDA stipend is approximately 1,500 people that are benefiting from the stipend. And the rate of success of the program, I could give it 7 out of 10. The highlights of the program is the volunteers are assisting with the COVID-19 grant application processing. That is the one for the 350. And they also assist at SASSA Access Point and Pay Point with the management of queues. They also enforce the lockdown regulations, whereby they make sure that the clients adhere to the social distancing protocol. The clients are wearing masks and they sanitize them on a regular basis. And of course, they also assist DSD and SASSA with distribution of food parcels with the assistance of the military and SAPs. And they also assist with the cleaning of DSD and SASSA facilities. And of course, they assist with services in the homeless shelters that have been created during the COVID-19 lockdown. The challenges of the program is the PPE provision, as the CEO has alluded, the transportation of volunteers to different service points. And of course, we have also identified the volunteer numbers that they are also lacking, and we wish that and hope that the volunteer numbers will be increased, as there is a lot of need of the volunteers out there. And of course, the risks of contracting COVID-19. And the recommendations for the program in the future, if there could be adequate resources to fund the program, and if there is better communication and organization from top to bottom, that is from up there to us down there to the CSOs. And of course, continuity extension and partnership with the CSO sector in assisting the most vulnerable and the poor. And I must say some of the problems and the challenges that the volunteers come across with is a lot of people that are queuing at the post offices, as Mayor from Eastern Cape has alluded, and there are thousands and thousands of people that are queuing on every day, and we hope that the increase of volunteers will eliminate that. Thank you very much.
Thank you very much, Mayor Pirime. Can we have a round of applause, please? Okay, next on our program, we have the province of the rising sun, Mpumalanga. Can we please ask Mr. Reggie Khwedi from the Mpumalanga Civil Society Organization to give us a presentation on behalf of the province?
Thank you very much, Mdula Stulo. I'm not Reggie, I'm Reginald Kwedi from Mpumalanga Provincial Institute of Civil Society Organization. And to Ms. Mzobe, you are forgiven. Apologies from taken. And we also thank you very much for giving us the opportunity to speak about the subject, which is evergreen in our society. The subject which also needs to deserve a serious attention. Because of the scourge of this pandemic, it has undermined and continued to undermine our health sector and the civil society organization at large. However, with our commitment, we managed to hit it below the belt as we became proactive in educating and informing the public. So now, with the provincial overview, the number of CSOs participating in the program 22.
Can I ask people to speak, to mute their speakers, please?
The number of volunteers is 220. However, initially when we started, we also, as they highlighted the other provinces, that they add the numbers based on the vastness of their areas, and we also did that. Females 156, males 64, youth 153, person with this other disability we didn't have. Total number of days worked, it was 6 months because we became proactive. We started immediately when we were given the assignment. Total value of stipends received from NDA, 492,600,000. Total number of beneficiaries living off NDA stipends, 220. Total value of stipends outstanding from NDA is 3,520,000. And the PPE is well received, though it was a bit late, but Ms. Mzobe highlighted it. Rating of success is almost 8/10. State of the organizations, the first 5 CSOs in the province are united and organized as they belong to one chat group for networking, which is also ongoing. Also, the CSOs plan to join hands with the additional 17 CSOs for further networking. These are the CSOs which were appointed afterwards. The CSOs share the best practices during the pandemic and how to navigate in uncharted territory like this one in the province and the country. Now, has the NDA facilitated networking and collaboration opportunities amongst the CSOs in the province? The NDA facilitated a group chat for collaboration and networking, which is also currently ongoing. Due to lockdown, there's been no physical contact amongst the CSOs in the province. However, most of the volunteers that we are having, they are coming from the CSO. Summary of services delivered, communities. To marshalling to add the pay points for SASSA, we had them. Registrations of beneficiaries done. Identification of beneficiaries for CSG grant and SINET program, we've run the program. Assistance with the SunPact virtual training, we were part of it. Assistance to DSD and SASSA with food parcel distribution during COVID-19 were the food soldiers on that one. Advocacy on COVID-19 pandemic in communities through pamphlets, door-to-door screening and testing of community members, and create awareness as our assignment. How has the program impacted on our communities? The communities have been impacted a great deal or positively due to the pushback on the pandemic in poor communities. Registration of SASSA grants beneficiaries, registration of UIF grants for the unemployed people has made a great impact for many as they receive their grant. Information is power and key to our communities as they've been given the COVID-19 awareness to ensure there are strategic ways to push back the pandemic, of which now they're able to practice what they've preached, what we have preached to them. In conclusion, the highlights of the program, needless to say, our volunteers contracted the coronavirus disease during the door-to-door testing and screening. Food distribution in communities were also the food soldiers. And SASSA appointment of volunteers to offer support to CSG's process, support to SASSA for registration of UIF beneficiaries. Obviously, there were quite a number of challenges that were highlighted by other organizations, which is the lack of support for PPEs, supply on time, vulnerability of volunteers who are without insurance. Let me highlight it because we had some volunteers who were contracted by this pandemic. No universal accreditations for volunteers to assist SASSA for registration, no gadget for registration of beneficiaries. Transport to and from areas of operations was also a serious challenge. I will not dwell much into that because other provinces has highlighted that. Now, what we are recommending to NDA going forward is that the volunteers be protected through COIDA whilst on duty, that volunteers be supported medically when they contract COVID-19, that the program be extended for 2 years to assist communities rid itself for COVID-19 pandemic, because as they uplift the level, there's a level of complacency within our community members. So there's a need for this program to continue. I thank you, Chair.
Thank you very much, Mr. Reginald Khwedi. We've got your name right now. Can we please give a round of applause to Mr. Khwedi? Thank you. Thank you. Next, we are going to take on the Western Cape. KZN will join us last as they are still sorting their connection issues. So can I please call upon Ms. Linda Mlanzeli from Gwebza Sewing Cooperative to give us a report? Ms. Mlanzeli, are you there? Ms. Mlanzeli?
Northern Cape is ready.
We have to go according to the queue, Baba. Okay, we will phone the Western Cape to check. Can we now take Northwest, and Mr. Brian Soul will represent the province, and he's from Walk a Mile in My Shoe. Mr. Soul, are you ready?
Almost ready. Can you hear me, leadership?
Mr. Soul?
Yes, ma'am, I'm here.
Over to you, sir.
Okay, thank you so much. Thank you for the opportunity again. I must say that COVID-19 has put us in a very predicament condition. My apologies. I'm keeping hearing feedback here, so it disturbs me. I'm trying to fix something here quickly. All right. Okay, thank you so much for the opportunity again. My name is Brian Saul. I'm from Klerksdorp. I'm representing the Northwest area. And the number of CSOs participating in the program were 22 CSOs, volunteer. The number of volunteers were 220. The number of days worked, it's 3 months in full. The total value of stipend received from the NDA is 4 organizations. Total number of beneficiaries living off NDA stipend is 40 families. Total value of stipend outstanding from NDA, it's 18 CSO the July month. A PPA received, it's still pending, no. And the rating of success for the program will give it 7 out of 10. And the highlights of the program, it's the job creation, CSO roles in COVID-19 in communities, poverty elevation. Challenges of the program were the PPEs, the stipends, and tools of trade reporting requirements of NDA. And I think these are common challenges that other organizations have highlighted already. And then the recommendation for the program in this future is stipend alignment to government rates. NDA prepay organization as before, branding and marketing of the programs.
Thank you very much, Mr. Soul, and thank you for sticking to the allocated time. Can you please give a round of applause to Mr. Soul? Thank you, thank you. I am now going to call upon Miss Linda Mlanzeli from the Western Cape. I'm told that she's now ready to present. Ms. Mlanzeli is from Gwebza Sewing Cooperative, and she will be reporting on behalf of the province. Over to you, Ms. Mlanzeli. Western Cape, can you please have your report?
Can you please unmute your mic?
Yes. Miss Mlanzeli, are you there?
Duties.
Please mute your mics because I can hear people whispering on the ground. Western Cape. Western Cape, can we have your report, please? Ladies and gentlemen, in the interest of time, while Western Cape is sorting itself, please give me a minute. Okay, Ms. Mlanzeli is ready to give us the Western Cape report. Please go ahead, ma'am. Ms. Mlanzeli, please unmute your mic. Can I please ask the Northern Cape to present? Ms. Teresa Thompson, you are next. Ms. Thompson is from the Nightingale Hospice. Over to you, ma'am.
Ms. Teresa Thompson is absent.
Yes, no, she is. Ms.
Oh,
Teresa Thompson is present.
Oh,
Sorry?
Thank you, ma'am. You are on the stage.
Who's on the stage? Ms. Teresa Thompson. Okay.
Yes.
Thank you. Akhe, Dumelan, good afternoon. I greet each and every one according to protocol. I'm Teresa Thompson from the Northern Cape, Nightingale Hospice in the heat of Etanjeni sub-district. And I'm representing on behalf of the Northern Cape. First and foremost, I must really say that the COVID-19 global health emergency and its economic and social impacts have disrupted nearly all aspects of life for all groups in our societies. And especially when we look at our young people on psychosocial and subjective well-being of them, and having households depending on them as well. In this regard, when we look at Northern Cape is a far, dry and vast, has got far and vast distances. And when we look at the population in the Northern Cape, it's 1.23 million people. The rate of unemployment is 32.4%. The rate of youth unemployed is 42.4%. Disabilities, 10.7%. Poverty headcounts living below 992 a month as from 2015. It's 59%. And the CSOs are 55% focused on education. The provincial overview, the number of CSOs partaking in the program has been 22. The total number of the volunteers, 220, of which females 99, male 81, and the youth 150. None of the persons with disabilities. The total number of days that has been worked as from April have been 20 days since June to August, 60 days. The total number of beneficiaries that they have reached living off the NDA stipend have been 178. The total value of stipends outstanding from the National Development Agency is 327,200,000 as at August. PPE was received, and for all this, the rating we give is 9 out of 10. The impact that the program has made. We provided guidance, COVID-19 regulations, social distancing, screening and sanitation at SASSA pay points, clinics, and other institutions. Food parcels has been distributed, assisted in packaging and distribution. SDR grants applications done on free mode on personal devices. Door-to-door disseminate information through the pamphlets and word of mouth. Collected statistical data, assisted to distribute almost 35,390 food parcels. Grant applications, 10,208. And advocacy with pamphlets, 5,257. Screening, 21,277. The challenges that has been encountered: declined applications, but solutions were reached. Applicants to update their status with previous employers. The second challenge, volunteers contracting COVID-19. We had COIDA and the UIF. SAPO running out of funds during paydays, whereby SAPO on its own had to link up with banks to replenish funds. Lack of ICT equipment for scanning CSO reports, but we managed to send pictures of reports. Other opportunities, CSOs could assist with applications proposed basic income grant. Volunteers can service far-flung and remote areas. It is a vehicle that can disseminate information faster, can be used as a referral to rectification of ID numbers, SASH and UIF, can manage donations of foods and clothing, etc. And I just want to add, before I just say thank you, Northern Cape had actually lost a great man, a great leader, a great comrade of SASSA manager in our district. But in spite of that, I must say the volunteers has been very outstanding in fighting the corona, because they never sat back to say the one person who actually accompanied us during this process is no longer there. But those that were there were really on hands. So I applaud them, and including DSD at district level. Really, they went all out to assist the volunteers. I thank you. Kia leboha.
A round of applause, please, for Ms. Thompson. Yay. Thank you very much, Northern Cape, for being generous with your rating as well. I shall now call the Western Cape again. Hopefully, they are now ready to present. Miss Linda Mlanzeli from Gwebza Sewing Cooperative, are you ready to give us your report? Western Cape, we waiting.
Whilst we are waiting for Western Cape, can I just say one thing from the Northern Cape?
For now, while we wait.
Yeah. Can I just say something whilst we wait, ma'am?
Yes, Ms. Thompson.
Yes, I really indeed, I had it on paper actually, because I wasn't using my paper, I was focusing on my presentation. But I really want to say to NDA team as a whole, I thank you for having actually nominated Nightingale to work together. And as we have been previously working together, but at this stage, I must really say, I was kind of wondering how I was going to go about with, you know, young people and the youth from different cultures and different houses. But nevertheless, I must really say, with their contribution that they have made towards us, it has really indeed brought a bigger picture of change amongst our youth in our area. And I must say that wherever they have been working, that has actually opened doors for them. And I hope, as I previously heard from several speakers, this is not going to end here. It is going forward. So maybe I'll see it someday, maybe I won't see it. I'm currently 71 and I'm on my way out. So, but I really want to thank you all for this generosity and contribution that you have made towards Northern Cape.
Thank you, Ms. Thompson. In the interest of time, again, I think Western Cape seems to be struggling with the technology there. Can I please call upon KZN to present? Ms. Tobile Msezane from Akekhulwa Luto Cooperative. Could you please take us through your presentation, ma'am?
Good afternoon, ma'am. It's not Tobile, it's actually Ndanda from the provincial office. Ms. Tobile is in our district office in Hluhluwe. They have been trying to connect with the development officer in the office, but seemingly they have got a network problem because they've tried both the laptop and the cell phone. They've been trying and trying. It keeps on saying connecting, but they are also saying they are suspecting that there is generally a network problem. We have been trying ever since we connected. She connected, I think, for 10 minutes, then it kicked her out.
Okay, ladies and gentlemen, you have heard the challenges that KZN is currently experiencing. Can I request that Gauteng do their presentation? Mr. Thami Mankenkeza from Wheels of Change. Over to you, sir. Mr. Makenkeza, over to you. I can see you here on my screen. Please give us a presentation for the Gauteng province.
Mr. Thami, your mic is off. We cannot hear you. I can see you are talking, but sorry.
Gosh. You hear me now?
Yes, go ahead.
Yes, we can.
Okay, it's been taking some time. I don't know what's wrong.
Yes, we can, Thami.
Okay, my name is Thamo Mzobe from Wheels of Change. We do skills development for people with disabilities. I'm here representing Gauteng province organizations. First of all, I'd like to thank SASSA NDA for this wonderful program in these trying times. Really, the program has been helpful to a lot of people who are beneficiaries of the SRD Grant 350. The number of CSO participating in Gauteng is 17. We've got a total number of 208 volunteers, which consist of 123 females, 85 males, 139 youth, and 17 people with disabilities. Total number of direct and indirect beneficiaries living off the NDA stipend is 364, and our rating is 7 out of 10. The highlights of the program is that as an organization, we've been administering the SRD 350 grant, SASSA-related activities. We've been doing new applications on the SRD. We've been doing recourse processes, status checks, pay point changes, adding of banking details, follow-ups, statistics submission on SASSA and NDA reports. We've also been doing SASSA-related activities. We've been assisting with follow-ups, mending on queues on SASSA, assisting on applications, on food parcels recourse. We've also been doing awareness campaigns, distribution of pamphlets, of NDA and SASSA awareness campaigns, and COVID-19 awareness campaigns. Our challenges that we've been experiencing on this program is that the lack of data. Volunteers definitely need to have data to successfully execute their task that has been given. Everything on this SRD requires data for you to execute. And for volunteers to be out there on the streets without data, unfortunately, it makes them look a bit of incompetent. So we'll definitely appreciate data. The link to changing of cell phones, because what we've noticed is that most South Africans and beneficiaries were not ready for this kind of technology, especially the targeted group that is supposed to be beneficiaries on this program. They are really struggling in terms of one, owning a phone, number two, definitely operating it. So with a link to change a phone number, definitely to help them, because a lot of people that are coming to the offices or we meet on the street, they are not able to check their statuses or follow-ups due to the fact that they've used a number that they've forgotten, or maybe it's a sister's number or a neighbor's number. So if hopefully we can be provided with a link to able to edit phone numbers. Another challenge is that your SARS, UIF, NSFAS, and SITA declines. When people are declined by those institutions, we're having it problematic as the institutions are sending those beneficiaries back to SASSA offices for the matters to be resolved. And it becomes a dead end for us, because if it says decline and then it gives you an institution, we're hoping that that institution will be well aware of and then be able to assist or clear the beneficiary on their system. Recommendations. Admin fee. We will really appreciate if the admin fee were to be paid in upfront so that organization can be able to get working material and be able to successfully perform the task that is given. Definitely now we are struggling with printing of volunteer sheets, submitting documents, because SASSA can only do a certain print per day. So in that, it's leading now for volunteers to work more than 5 hours a day because they need to come and collect papers and volunteer sheets daily and also submit. So we'll appreciate if the administration fee could be paid. Another recommendation we'll appreciate is a link of organizations to SASSA help desk for quick queries and quick responses, because we've noticed that volunteers are being frustrated with not having a valid answer for them. And we've noted that also SASSA offices, unfortunately, do not have much info when it comes to this SRD grant program. The last issue will be your stipends. We will really appreciate if stipends can be increased to a minimum wage. We all know the government has regulated that people should not earn less than 22 Rand per hour, but when you calculate on this stipend for this program, it amounts to about 15 Rand per hour to 75 Rand a day, where in which volunteers still need to travel on that, they still need to eat on that money. So we'll appreciate if that can be considered and the minimum wage is applied. That's all. Thank you.
Thank you very much. Can we ask the Okay, thank you very much. Ladies and gentlemen, we are almost at the end and we ask that you stay with us so that we can wrap up nicely, because we'll still call on the CEO who will just give us, we will summarize the inputs and talk about the way forward. Can I ask that KwaZulu-Natal present? I'm told that they have Ms. Phumzile Ntuli from Kalekhaya who will present on behalf of the province. Over to you, KZN.
Western Cape, ne? Ke kopa re try Linda one more time.
Babumbongose ngiyabona wena obuyile futhi. Can we please have your presentation on behalf of the province?
Hello.
Oh.
Hello.
Yes, good afternoon.
Yes, it's Phumzile.
Siyabonga.
Yes. I'm coming from Kalekhaya Cooperative at KwaZulu-Natal. My report. Hello, do you hear me?
Yes, we can hear you.
Okay. The total number of volunteers is 220, women 157, men 63, youth 146, person with disability is 0. Total number of direct and indirect beneficial living of NDA stipend. Direct is 220, indirect it's 1,320. Rating of Sussex. Program rating is 8 out of 10. Impact of the program. The program increased the footprint of NPA and its programs within the province. The volunteer stipend contributed to increase in the household income. The CSOs also experienced cash infection, resulting in a positive cash flow. Mr. General, the sector is not receiving enough funding, especially from the private sector. For such good working relations between DSD portfolio and the following stakeholders using the Sugumasake and district development model. Journalists, Department of Health, Cooperative Governance, Department of Human Settlement, Department of Arts and Culture, Department of Education,
Ma'am Tuli, your volume.
My volume is not good.
That's better now, yes.
Oh, sorry. Challenges of the program. A negative attitude of the post office and government officials in general towards the volunteer, even though the volunteer and their work had been introduced. Non-provision of data. Volunteers use their own data to support community members. Conclusion, recommendation for the program in the future. Representation in all local municipalities. 1 CSO per LM local municipalities. Extension of the program. Increase CSO administration fee. Increase number of volunteers per CSO. Include the CSO managers or coordinators when ordering PPEs, and they also participate and monitor most of the activities done by volunteer, and this exposed to the same condition. Thank you.
Thank you very much, Mantuli, for that comprehensive report on behalf of KZN. Can you please give her a round of applause? Thank you. Last but not least on the provincial presentations, I'm gonna ask the Western Cape again, one last chance. And if Ms. Gwebza cannot connect, can we ask that Mr. Adil Suker present on behalf of the province? Thank you.
Unmute your mic.
Western Cape, can we please have that report? Mr. Suker, are you there?
Yes, I am, ma'am.
Could you please present on behalf of your province?
Okay. Apologies, and with the permission of the CSOs of the Western Cape, I'd like to present the report on the volunteer program for the Western Cape. The number of CSOs that we've recruited for the program is 22, and we have 220 volunteers. 209 of them have been trained, and 201 has been accredited thus far. We've managed, the volunteers has managed to register online 20,375 grant applications. 185 volunteers have received PPEs, and obviously we haven't received any data for volunteers. The number of pamphlets distributed is 3,307. The total value of stipends received from NDA is 414,000, and they benefit 220 volunteers, beneficiaries, all that's active have received PPEs. The highlights of the program: the stipends for the unemployed volunteers is a needed support. Training and skills development for volunteers. SASSA provided training to volunteers to conduct their work. And the income for CSOs, we know CSOs are struggling and this income is needed. And challenges of the program, obviously, as people mentioned previously, data for online registration and submitting of reports, monthly reports and weekly reports by CSOs, a delay in the payment of stipends and lack of transport, all challenges which were mentioned previously in the reports. The recommendations for the program in future: SASSA to speed up the data rollout for volunteers, NDA to shorten the turnaround time for payment of stipends for volunteers, SASSA and municipalities to assist with transport when needed, and volunteers to be provided with ongoing training to improve skills and knowledge to improve their employability. Thank you.
Thank you very much, Mr. Suker. Can we please give a round of applause to the Western Cape? And also, can we give a round of applause to all the provinces for their wonderful presentations? Ladies and gentlemen, we are nearing the end of our program, and I'm going to be very strict on time with the next presenters. I will only allocate them 3 minutes each. At this stage, I would like to call the CEO of the NDA to summarize some of the key inputs from the SASSA and NDA presentations and talk about the way forward. Over to you, Mrs. Mzobe.
Thank you very much, Program Director. I think mine is to appreciate the experiences shared by the leadership in terms of the frontline workers that we have. And as a way forward, I want to summarize what the CEO of SASSA had said earlier, as she said that I did hijack her. For us, we don't have to prepare, we have to walk the talk. So if you prepare a person in advance, it's like you have something to hide. So for me, it was to say, yeah, your people, I wish you could stay for longer so that you can indulge in their presentation. But safe to say, the issues that she touched on are the issues that I touched on earlier. On legislation, your National Treasury, your AG, they are here. As much as the work is done, but they will ask and chase us to say, there is no evidence, this is not regulated. And we couldn't have regulated anything. It's new for all of us. But in those few words, I want to say, as a way forward, in facilitating the stipend payment on time, I'm pleading for your support in the correspondence that we require for us to finalize the stipend. When we started, remember I said there was no time to delve on the compliance to legislation. However, after 21 days, it was very clear when the president pronounced on the SIU to audit already, because there were almost the red flags on how the funds were being siphoned irresponsibly so. So I'm pleading to say what we have worked with National Treasury to assist us to fast track your payment is for you to give us the report as identified items. I'm sure provinces have had a discussion with you to say these are the documents as a checklist that we need for us to fast track the payment. The sooner we get those documents, the better and the quicker we'll pay the stipend. So work with me, cooperate with us as we venture into this efficiency in the payments of stipend, number one. Number two, the issue of disability. I want to implore your good thought in terms of leadership. How best can we address on this matter? Because we can not leave it unattended. As a country, especially from the activism point of view, we are supposed to have at least 7% that we give into in terms of the support, the interventions that we give to the people with disabilities. So it is through your guidance, because you are on the ground. You think, when you think about disability, it's not only wheelchair bound people, but those who are using sign languages and stuff like that. So if you have recruitment of such nature of people, we really would appreciate your guidance in navigating and getting to attract those people so that they become part of the program. They struggle like anyone. Not all of them, they do get SASSA grant. So we are reliant upon your guidance on that one. In terms of the transport is the issue that we're deliberating on. We will continue to deliberate on between SASSA and between NDA, SASSA, and social development. We had a discussion at MINMEC where Minister chairs a forum for MECs and HODs to say, how can we piggyback on the transport when social workers are doing their site visit, when community development practitioners are doing their site visit, to piggyback on such arrangement of transport. Same with SASSA. Other provinces, there is an element of en route in addressing that problem, but we'll continue to discuss and influencing policy reforms. On COIDA and other areas related to contraction of the virus, it's still early for us to venture into that. It's a journey that we need to be very careful in venturing into, because it has not yet been declared a permanent program like your EPW program. However, it's the discussion that we've already started and will continue to pursue. I must indicate that it's never easy to fight policy reforms. There are people who are happy with the status quo. Whenever you come with these ideas from the understanding of community development, there'll always be pushbacks. But bear with me, be patient with me as we continue to influence and continue to engage on policy reform. However, we do take it serious that we need to have a provision for such. Then we will share the information in terms of all the inputs that have been shared. We will be giving a full report to the minister. There was a recording of this meeting. We are happy to share with all civil society organizations all these recordings so that you can reflect going forward, and it will measure us going forward to say, from now on to our next session in terms of this platform, we must begin to checks and balances, tick where we are doing well, where we are improving, and look at the areas which are still of a challenge, and look into resolving such challenges. So we are happy to share this recording, registers, and everything so that you can measure us on such. But let's continue the fight. The struggle it's a long walk. It's a long walk, and I know I'm speaking to the converted, but I know we can beat this together. We can walk this journey together in changing lives of our community. With those words from my part, thank you for your indulgence. Thank you for your patience, your resilience, your courage, and especially your expertise in leading from the front. Thank you very much, Program Director.
Thank you very much, CEO, for those inputs. Without wasting time, I would like to call upon Ms. Lerato Dlamini, who is the Acting Corporate Services Executive at the National Development Agency, to give us the closing remarks. Ms. Dlamini, you only have for 3 minutes. Over to you.
Thank you, Program Director. I would actually like to thank.
They still waiting for confirmation. Yeah, the documents.
I think I'm hearing a background noise. So that
Can I please ask people to mute their mics? There's an echo. Please mute your mics if you're not speaking.
All right, thank you. In closing, I would not repeat or say what has already been said. However, would like to actually appreciate and indicate that the NDA is actually honored to have you as an audience and participating up until this evening, as when we actually started earlier with us trying to get envisage with the technology part and participate and
will really, we really feel honored with your passion, the stories that have actually been presented. It's not only the stories to justify the work, but it's the stories to indicate that we as a citizen, we are definitely living, the NDP 2030 that says we need to actually have active citizenry, where we would go forward and soldier on with the issues that are facing the country. And we've already lived that by showing a passion in what we do. With the limited time, I would also like to give comforts to say, as indicated, that all the issues that were raised, as indicated in terms of like the extension of the project, shows a passion in wanting to continue even beyond the pandemic itself. The issues around our weaknesses as we fine tune this program, issues around strengthening the communication, the openness in dealing with the issues, it's very critical from all the parties, collaborating with the people that are on the ground and people who know better and be informed, and running programs as the organization or as an agency in a manner that would include the communities themselves and be informed by what is actually going or happening on the ground. That is actually very much noted, and it's captured, and the comments which are actually coming or which came throughout the program. What we will do as the part of strengthening the communication, we will consolidate them, package them, and provide written response, because we were not able to go through each and every one of them and respond to each and every one of them as they were coming through. But we'll package them in a manner that at least it provides direction and a tracking sheet of some sort that indicates the status of the issues that they actually been raised. As CEO has actually indicated, especially with the areas around the quick turnaround payments, the majority of the comments that actually came in indicated that like we need to improve on the week turnaround times, with following all the processes, the regulation and any other procedures that are needed to be in place. Will urge that as we work on the turnaround time, you also work with us in providing the necessary information for or necessary information for the payment that is due to the volunteers. And voluntary job has actually started way back, and it has been proven to be a most effective way to actually give a helping hand within the community. And then in those words, I would like to appreciate and say thank you, and we will continue to have more and organize more webinars in this particular platform, and also assist as well in the issues around data, so that we engage more, so that we get into giving the words to the communities themselves, and have a better participation, and to cover more people on the ground. Thank you very much. I will give it back to you, Program Director.
Ladies and gentlemen, it's been quite a long afternoon, and we have come to the end of our sessions. But right now, I would like to call Mr. Kensani Mthembu, who is the Senior Manager in the Office of the Chief Operations Officer, to give us a vote of thanks. Over to you, Pastor G.
Thank you very much, Chair. Good evening, colleagues. Good evening, CEO, COO, Acting Executive Corporate Services, provincial managers, CSO leaders, our development practitioners, across the length and breadth of our country. Thank you very much for this opportunity. Mine is just to do the vote of thanks, which is sort of the easiest thing to do. You just look at the program and read out all the names that have participated. But before I do that, let me just clarify the issue around the conditions for the payment of stipends. To just confirm that we, since last week, because the month ended rather on last week Monday, and since then the provincial managers have been collecting and collating the information that is needed. And to make our job easier, colleagues, as you submit, is to ensure that you submit the timesheets in a proper manner, ensuring that they account for every hour that you've worked and every person that has worked. So there are timesheet templates that you've been using, and also the monthly reports from yourselves, which are then collated by the provincial managers and come up to the national office and are checked. As you may recall, both CEO, our CEO Mzobe, and Metotsi, the CEO of SASSA, emphasized the issue of compliance and the AG and so on. So we take a very painstaking process to ensure that all those things are in order. That's why it's taking a bit longer rather than risking submitting things that are not in order and they jeopardize the program. But we are hoping that we will make the payments in the next, during the course of this week. We will be starting to make the payments. Those that we still need to come back to, we will come back to you if there are any outstanding documents that are needed for us to ensure that the payments are done. And as our leaders have committed, the CEO has committed, we will endeavor to make sure that those are done on time and there is some certainty around the payment of the stipends. Having said that, colleagues, allow me to thank all of you for making time. It's been a long day from 3 o'clock. It's nearly 6 now. You are still here, committed to the cause, ensuring that you engage. Thank you for the opportunity that you've provided to us as the NDA and SASSA and DSD to have a personal touch with you under the circumstances. This has been very good. Some of us who are working in the background know names and numbers, but today we've been able to hear voices. I know that we did not hear many voices, maybe not more than 20 voices, but the voices that we've heard have represented all of you, all the volunteers on the program. We really appreciate your work and thank you very much for attending today. I also want to thank the CEO for hosting us today and ensuring that there is this opportunity to interact. Her commitment to the program. We thank you very much, Mzobe, for that. We want to thank the COO for her leadership, Uma Susan Kumalo, leading the team of provincial managers, as well as ourselves here in the office. Thank Melerato Dlamini and your team for organizing this workshop under these very difficult circumstances and ensuring that people can connect, ensuring that we can have a successful interaction. And thank you very much to yourself and your team as well. And also thank the provincial managers as well, who are the foot soldiers on the ground of the NDA, together with their teams of development practitioners who ensured that this program comes to fruition. The vision of our CEO is implemented and becomes something that is a reality. Thank you very much for all your work, and also thank you to all the CSOs, as I've said, all the colleagues who have participated in the program, who have asked questions. We also have the questions that has been asked online, which we are taking on board. And thank you very much. Let me hand over to the program director with those few words and to say good night and have a restful evening as we continue to make a difference in our communities under these difficult circumstances. Thank you very much.
Thank you, Pastor G. And I would like to say thanks again to everyone for the wonderful work that you are doing in the communities. You can give yourself a round of applause. We have come to the end of the program. I would like to say good night. And those who are driving, please drive safe. And we are hoping that next time we have this session, we will get an average of at least 9 out of 10, if not 10 out of 10. Thank you very much. This meeting now is adjourned.
Hallelujah. Thank you. Bye.
Ahora lebogile. Lebogile haholo. Amen. Thank you very much. Bye-bye.
Bye.